limited fiscal space in Zimbabwe. Therefore, we as the private sector also have to play our part, more so to help attain that herd immunity.
Excellent. I really like what you're describing there, Vuli, where as private sector, you've seen it fit right from the onset when the pandemic struck to come on board and partner with government. Now, the two of you are two out of about 20 or more private sector led medical schemes, facilities in Zimbabwe. How is this whole game being coordinated? Where do you meet to share your plans and make sure that the partnership with government, the partnerships amongst yourselves are well coordinated? And what's the go-to place for us, ordinary citizens, when we want to know more information on what is happening? Over to you, Doug.
Thanks, Lindiwe. I think an important part from my side is that we are members of the Association of Healthcare Funders of Zimbabwe. There's been a lot of discussions. There was a recent webinar about this. Obviously, health funds operate in different realms, but I know that speaking on behalf of AFOS, there's been a majority decision to say, yes, we're looking forward to supporting, especially up to a minimum of our principal membership. Obviously, there is some societies that offer different health schemes that have vaccination benefits, etc. Those will operate in a slightly different manner. We're all also aware that this has to be voluntary, but has to be accessible and available to membership who want it. I think I also like the idea of the partnership through CZI, which CIMAS is driving, and the combination of the working with business and together with our associations, working very closely with the Ministry of Health to make sure that we are fitting in with government's program as we roll this out.
Excellent. So you're bringing in a very important component, because the people we have seen on television, the people we've heard vocal about this whole issue, CZI and the industry, the coordinated private sector industry, saying, government, we are ready to help you. We are ready to put in money in the kit to help roll out. But you, as medical aid associations, have also seen fit to be in the forefront of that game and make sure that you are coordinated through your association of healthcare providers, but also with the private sector putting in resources. I really want to take a deeper dive now on, we are hearing so much about different vaccines that are available. So walk me through the journey. Vuli, are you there? Where are you going to get these vaccines? What vaccine is it? Do your members have a choice? Can you just help us understand, if I wake up as Lindiwe tomorrow and I want to be vaccinated, and I'm a member of CIMAS, I'm a member of Masca, what does it all mean? And at what stage can I do that? Over to you, Vuli, on behalf of CIMAS.
Thank you, Lindiwe. The issue is that while we act as a medical aid, I think the paramount thing is to recognize that we're trying to act more as a corporate citizen together with other corporate citizens to deal with a problem that faces us. First of all, as medical aids, we're limited in the coverage that we have. In my own estimate, less than 10% of the country is covered by medical aids. And therefore, no matter how much we do as medical aids, it's not going to make it have the impact that we would like it to have. And that's part of the reason why we then linked up with the business. Bankers Association of Zimbabwe, the Chamber of Mines of Zimbabwe, Insurance Council of Zimbabwe, Bankers Association of Zimbabwe, Zimbabwe Council for Tourism, and the Zimbabwe National Chambers of Commerce, ZNCC. So the idea was this, that as we engage government, we do so as a collective, we do so as a private sector, but also to bring in efficiency into the process, because each one of us cannot, for example, be able to procure vaccines or procure and distribute vaccines efficiently We think critical mass is important because the most efficient way of procuring vaccines is from the manufacturers. So the
Yeah.
first port of call for us was to engage the Ministry of Health, which we've done since about 4 January this year. And lately, the Ministry of Finance who are coordinating the financing of these vaccines. And together, working with other private sector players under the BMO umbrella, but also with the other medical aids to actually try and see how we can consolidate our efforts in reaching as many people as possible. And you know that government has already acknowledged that the private sector can play a role. And one of the issues they put out was that whatever vaccines we procure, 50% go to the public sector. We are not averse to this because basically it helps us contribute to the public health cause. It helps us also contribute to that. I spoke about the limited fiscal space that the country has got. It helps us contribute to that initiative. As much as government has launched other initiatives, which we also urge our partners to support. The issue is there's a lot of money required, and if we can dig into our pockets and make it happen, for me, that is the key message. Let
Excellent.
us aggregate our efforts, dig into our pockets to make this to happen. It is probably, the way I see it, the fighting chance that we have for this pandemic. In terms of
Excellent.
the process itself, I can fill that in later, and some of my colleagues will do so.
So, Vuli, what I'm hearing from you is that you now have a coalition of private sector actors who got together and approached government to support. But in that space, government has put in a request or a condition that whatever monies you put into the kitty to buy X number, say 1,000,000 doses of the vaccine, 50% of that will have to be a donation towards public sector so that we safeguard those lives. And as private sector, you're saying you're comfortable with that, and at least you're speaking for CIMAS.
That is correct. That is correct.
Excellent, excellent. Now, let's just go back to, whilst I have you, on the types of vaccines. Is there a restriction? You've been clear to us that it's easier when you buy in bulk, it's easier when you partner with government, but what is on the plate? What are the different types of vaccines that private sector will be accessing and purchasing for rollout in Zimbabwe? Is there any control over that, or you are free to bring in as many into the menu?
Okay, so in our discussions with the government, we have we've set aside certain parameters. For one, what kind of a vaccine are we talking about? It must be formally approved or certified by the World Health Organization. And you see, this is public information. It happens every day when these vaccines are announced as to what is their status with the World Health Organization. So that's one of the things that we've put down. But we also talked about that. It must be registered and can be registered in Zimbabwe under a special registration process. The Medicines Control Authority of Zimbabwe manages this process. The vaccine also has to be affordable. Our resources are limited. As much as we're talking about the corporate sector in Zimbabwe, that corporate sector is under extreme financial pressures. They do not have unlimited resources like some countries have. Because we've been hit hard by various things, we are also struggling to survive economically. So the vaccine has got to be affordable, but there's also issues about feasibility of the cold chain, management and the storage of the vaccine. There's also issues about, it takes charges on what the World Health Organization would have approved, documented efficacy of the vaccines. For now, I must say that our approach is that we would like to bring in maybe a choice of vaccines to start off with, because we may not be able to get all those vaccines from one source. So there's work going on behind the scenes to try and make sure that that happens.
So, Doug, can I come over to you, Doug? Vuli has touched on the issue of affordability. He's spoken about a registered vaccine, one that is practically easy to maintain the cold chain requirements for, but also the efficacy and WHO registration and Medicine Controls Association registration compliance. But the bottom line is cost. You can put the best menu on the table for me. If I can't afford it, it's as good as not there. What does affordable mean? What have you worked out as an affordable price tag for the different options that are likely to be on the table?
Yeah, so I'm in full agreement with what Voli's been saying, and just wanted to add one thing, that obviously this is all in coordination and with the approval of the Ministry of Health. Going on to the affordability, obviously the Ministry of Health has been looking at that because, again, in our fiscus and in our country, we're all striving to come out of economic challenges that we've been facing over the last few years. And even though our Honourable Minister of Finance has put aside money, there's still challenges to make sure that we can get the most for our money. And if you look at some of the vaccines that are currently in use in some of the Western world countries, they are quite expensive. But the current rollout in Zimbabwe has been with the Sinopharm vaccine, which shows a lot of potential. I know that the Russian Sputnik one is also financially more affordable. There are more recent private sector ones, things that fit into the cold chain and affordability would be the J&J. But there's also other initiatives that the ministries and our government is working with that bring in certain vaccines that will follow all those protocols. And in what we're really doing as industry is making sure that we fit in with the protocols that are there. And I'm quite sure as well that the government will make sure that affordable vaccines are made available. It's not about prioritizing the most expensive for us. Remember, all these vaccines are also all brand new. It's not a matter of being expensive being the best. It's different types of vaccines that are available, and I have full confidence in our Ministry of Health to make the right decisions. I'm a strong advocate of the Medicines Control Authority, and I know that we strictly adhere to principles here in Zimbabwe. And backing behind that is really industry and the medical funds saying, we're here, we're ready to step up as citizens of this country. Let us work together to find it. But I also do agree with Voli that maybe not just one, but a choice is available to give people some. The choice gives them a bit of satisfaction in themselves about I voluntarily choose, and I can also choose this. I don't have to have a specific type. And I think that the Ministry of Health will look at that.
Yeah, thank you. So I'm comfortable on the fact that what's going to be on the table or on the menu is approved, it's vetted, it's registered, it's in full compliance. I now need to make a choice as Lindy. And one of the deciding factors for me is going to be, is Masca, is CIMAS, is whoever going to cover this vaccine 100%, or I have to top up? What is affordable? Can I nail you down on that affordability?
I think we're looking at an average cost of around $10. But also the fact that any excess vaccines, if we don't get a good voluntary rollout, any excess beyond even the 50%, if that's the figure that is eventually agreed upon, would go back into a government program. We're never going to see this vaccine being tendered out and being, so we would make sure that there's a conscientious effort to make sure that these vaccines are not to be paid for by people.
Excellent.
On top of that $10, there's obviously the regular costs that we have from treatment centers like the CIMAS clinics, etc., where there's obviously a charge to administer this. And I know that being corporate citizens and a lot of the health professionals that I work with would actually do this at a minimal charge, just to make sure that we roll this out as quickly and efficiently as we can to assist government.
Excellent. That gives me a lot of comfort. When you say $10, I think that's my airtime for the month, and it's something I can sacrifice to cover my whole household. But coming back to something that you've brought in, that when you get your 50% allocation, assuming there is no 100% uptake, you can still donate that. What has been the
Exactly.
appetite like? Have you done any studies? Bully, I want to come back to you. As CIMAS, do you have a rough idea that if you wake up tomorrow and you have the 1 million doses available, are there any takers? Have you done any quick and dirty studies to say in my office or in my membership as CIMAS and their beneficiaries and families and extended families, I already have a queue of people wanting the vaccine? What's the appetite in Zimbabwe like?
I don't think I'm in a position to answer those questions because really I've been focused on make sure that we get the vaccine and on the assumption that there is as many people as want the vaccine. But maybe one of my colleagues who is a clinician may want to come in and answer that question, Dr. Chirisa, if you don't mind.
Dr. Chirisa, if you're there in the audience, please give us an indication. What is the appetite for vaccination like in Zimbabwe? We have private sector, we have our medical insurance entities, all hands on deck wanting to bring the vaccine. We wake up with the vaccine on the table. Are they takers on it? What has been the appetite? Doug, before Dr. Chirisa comes in, do you have any idea from your own entity, from Masca, from your membership, has there been any expressions of interest for takers who are ready to go and be vaccinated?
Nothing concrete, but just word of mouth and discussions with various firms. I think there are a number of people who would take it, and I'm assuming it's going to be more than 50%. We're obviously not going to get our full 100%, but I'm quite sure in Zimbabwe most of the business and the private community, and even the public sector community and the working community, are educated and are understanding this illness and also understand vaccines. But also Dr. Dixon, who's our medical advisor, is on call as well. Perhaps he can add something to this as well if after Dr. Chirisa has.
Thank you very much. Batavile, if you open the room for Dr. Chirisa and Dr. Dixon, in case they want to express their observations on what they are seeing in their rooms and in the public in terms of appetite. I'm looking at the charts that are coming in. One of the interesting interventions is that you guys, CIMAS, Masca, and all the others want to charge when government is rolling out for free. And then someone intervened and said, how come you're paying $60 for a PCR test, and when it's now a vaccine, which is adding to your life, you are being asked for about $10 and you are crying foul. Interesting conversations that are happening. Coming back to you, Vuli, we talk about the approach you have taken, coordinated with government. Who is doing the number count? Who is doing the number crunches? You've been saying that you have 10% coverage. So it means 10% of the population of about 14 million plus. That gives us what, 1.4 million that you are going to cover. That's not a lot. So who is doing the count of how we augment what government is doing? Because 10% is really 1/10 of the journey. How do you see this whole thing playing out? And what is private sector saying about pumping in more money?
Okay, if I can come in, Lindwe. First of all, in terms of who is doing the count, we've set targets based on what we believe is the affordability. Targets are you set a minimum target, and if it can be exceeded, so much the better. So our initial target is doses for 1 million people, to cover vaccinations for 1 million people. But we would like to stretch that to 2 million people if we can. How are we counting that? How are we doing? We already have got commitments for more than half the initial amount that we're looking at, and it's rising. So I'm confident that the doses for 1 million people we should be able to do. But I'll be delighted if we can do more than that, because we understand, like I said, the fiscal space is limited. The more we do for everybody, the quicker the country gets herd immunity. So for us, it's depending on ability. And one of the reasons we appear on forums like this, I appear on forums like this, is to make that further appeal to all members of our community who can put funds towards this effort, because it's a question of the more people come in, then we're able to raise more money. So for me, that's the key message. The other earlier question that you asked was about, do people want to take the vaccine or don't they want, or whatever those issues are, which my colleague Dr. Chirisa will deal with. All I can say is my job is to encourage as many people as possible to take the vaccine, because that is the advice that I received from the clinicians. So we will, even as a medical aid, be putting out messages to encourage people to actually take this vaccine, because we see benefits in it. We do not believe that as of now, there's no cure for COVID-19. We see it as the best plan that we have to actually deal with this pandemic. There's two other things that you throw in, which I'll deal with as well, in a question of, do we want people to pay for this COVID vaccine? I can tell you our position as CIMAS is that our members should not pay for this vaccine. The position of the corporates that we're dealing with, who have put forward their money, is that they want to pay for their employees, their dependents, and some of the communities that they serve. So there is, like Doug said earlier on, there is no intention to charge anyone for this vaccine. Maybe
Excellent.
Dr. Chirisa can come in on.
Yeah, we are trying to facilitate Dr. Chirisa's entry into the room. But what you are raising, Julie, are really, it's a coordinated act. And one of the questions on the chat has been, it's CIMAS and Masca. What about all the other public insurance facilities? Are you coordinating with all 20 others? I think you touched on that. And what people want to know specifically is the public service. People who are on public service who are not necessarily high priority. Are you in meetings or in platforms where you've seen these other players also playing ball? I don't want you to speak for them in their capacity, but is everybody, are all hands on deck? Are you seeing all the other actors that should be around the table participating?
From my point of view, because I sit on the Association of Healthcare Funders together with Premier Service, who covers the majority of the public sector, and other members as well, and the other more than 20, it's close to 34, I think, in total, medical fund institutions. There is a willingness, as I've said, to at least cover the minimum of the principal members. And I can speak strongly for Premier Services, as they are an active member of AFOS, which is the association that we're all members. And they are fully behind the government program and the private initiatives to ensure. And I just wanted to make a point that if there is 10%, remember, if firms and ourselves are contributing towards it, if we can get 50%, that's as 50%, that's a further 1.4. So that makes close to 3 million lives to support the whole program, if we can get enough fund from the private sector for that.
Amazing initiative. And as I can see, all hands are on deck, and there is a coordination mechanism. You get CZI, you get Bankers Association, mining, pension funds, tourism, ZNCC, all putting resources together, and you, the medical insurance guys, making sure that the rollout is smooth. I really want to hear the voice of our Dr. Chirisa. Over to you. What would you like to say?
He's unmuted now, so I think.
Yeah, over to you, Dr. Chirisa.
Thank you, Madam Chair. Definitely, the uptake of vaccines has been tricky all over the world, especially more so in Africa, given the level of conspiracy theories which started all the way back from last year with the G5, the 666. And I would say that there is fear.
What is G5? What is 666?
The G5 technology in terms of cell phone technologies.
Yeah.
And the biblical, end of the world kind of like 666, the mark of the beast and all that. So there have been quite a number of theories which have been peddled since last year. And they have actually brought a lot of uncertainty and fear, not only among, the general public, but also among, frontliners themselves. I was at a clinic on Saturday, and I was just talking to them and saying that city of Harare wants to immunize you, and there were screams, practically people saying, no, we want no. So there's a lot of miseducation that has gone on, and it's going to take a lot of effort to educate the public. And this is one of the things that we have been doing even in the vaccine presentations that we were doing. We were not taking it lightly that people know exactly what a vaccine is. And we went to length together with Vuli to actually explain what, the different vaccines, what they are. And what we have seen is that when people get information, when people get adequate knowledge, which is something that I think it becomes very paramount for us to start to do, to have that awareness campaign, even among ourselves and among, our members in medical health societies, so as to increase the uptake. Because without adequate uptake, we will still have another third wave happening despite the immunization. So now answering your question, having said that, we at CIMAS we have actually decided to do a survey to say who is going to accept or who would want if it's made available. But we also know that that survey would be a rolling stone as people would change thoughts and ideas as knowledge and information is continued to be rolled. But definitely there are people that are ready to go, quite a number, especially of the doctors and the nurses that are aware of the risk that they have encountered. They're actually ready to get the vaccines. Obviously, there's a lot of reassuring which is needed. I've received a number of calls from doctors asking us, so should we go? Should we not go? And I would say, look, let's go. And we also need, a public campaign where senior influential doctors will actually get that jab, in the public, just like what the VP did. It will also help in increasing the numbers, because definitely for us to reach that number that will protect the whole nation, we need a lot of numbers that will be vaccinated. Thank you. Over to you, Madam Chair.
Thank you, Dr. Chirisa. It's interesting that you mentioned that our very own frontline healthcare givers, some of them are skeptical and afraid. And I think we have a job there, because if we see them in the front line getting the jab, then we know it's safe. They are the people who understand the technology. They are the people who need to give everybody else the confidence that it's the right thing to do. This, colleagues, answers the question of, if we are going to be procuring all these vaccines, are they going to be put to use? And are we going to tame the pandemic? And it's clear that there's a job to be done. There's a lot of advocacy using evidence that needs to be done. But most important, we need to make sure that we have the vaccines, they are affordable, they are registered, the cold chain is maintained, the efficacy levels are convincing, so that we tame the disease. That's the end goal. I want to come back to, is Dr. Dixon in the room? Because a couple of weeks ago, under IM for Bulawayo, we ran an interesting session where we had Dr. Zozo, Dr. Wedun Debele, and Dr. Dixon, where we had our clinicians talking about what is vaccination, who should be vaccinated, and what are the benefits of being vaccinated right up front. So it would be good to have Dr. Dixon come up. And under IM for Bulawayo, going forward, our next series will be dealing with myths and facts. Ordinary citizens talking to us about their fears, and also getting a rough count of who is willing to go for the vaccine. Maybe if we can do a poll right now, We have 67 people on this call. Can I see by show of hands who is ready to take the vaccine? Batavile, our administrator, will do the count. I'm putting my hand up front, and I just want to see who is ready for the vaccine. Then that's already a barometer test of what's going to happen. All right, the count is beginning now. Can we see the thumbs up of who is ready? Vuli is ready. Doug is ready. I am ready. I'm waiting to see the countdown. I am ready, but I've been lucky. Of our panelists, Vuli and Doug, has any one of you had the real experience of this monster? If you're free to share, please come on board and tell us what it's like.
So I've been fortunate and not had it at all, but Vuli?
Over to you.
Unfortunately, I haven't been that fortunate, so I did spend Christmas in isolation, and I'm not having another Christmas in isolation, so I will take the vaccine.
Amen.
My colleague, my colleague, Dr. Chirisa, also has had COVID. Fortunately, both of us were mild, and so we managed to come out better than most. But I think for me, for the experience, and maybe that is what inspired me to be more serious about this vaccine.
Excellent. I really like that testimony, Vuli. I've got another testimony from Dr. Wedun Debele. He had his jab today. Our colleagues, as you can see, let's come out and talk about this. We shouldn't stigmatize it. We should be in the forefront to say, I've had this, it's gone, it's nasty, I don't want it again. And vaccination for now is the best solution or prevention. So let's go for it. And with the numbers, $10 I'm hearing, and the cocktail of choices that we'll have, we shouldn't have a problem. Please open up for Vuli so that all other speakers are not muted. Now, coming back to this rollout, we are now clear that there will be a cocktail to choose from. Who is going to guide that choice? I mean, as you did mention that the procurement in bulk is facilitated by the partnership with government. The options are multiple. As an independent individual, how do I make the choice of which jab to go for, and is there that option as provided by the medical insurance insurers, or you take what's available at the time of procurement and rollout? Over to you, Doug and Vuli.
Linda, could I just maybe bring Dr. Dixon? I think he's unmuted in on this. He'll be more guiding it.
Mark,
thanks.
Dr. Dixon, please come on board. We're looking for you.
Sorry, Mark, to put you under pressure.
Your voice
what are you
is
asking
important.
me? Which vaccine?
Yeah, welcome, Mark. Mark is muted. Please unmute, Mark. Thank you. You are unmuted now.
Hi. Thank you for having me. Yeah, you've unmuted me, which is always a dangerous thing to do. I'd just like to say three things. One, the last one about the choice of vaccine. The first thing to say is that this is a public health crisis we're in the middle of. And one of the basic tenets of public health management of problems like this is that society offers prevention and treatment equally to all citizens without any financial barriers. It's the reason that measles vaccination, polio vaccination is free of charge. It's the reason TB treatment and diagnosis is free of charge in Zimbabwe. And the same should be true for COVID-19 management. And I do say I've been a little disappointed by our inability to make testing and as vaccination comes along, free of charge to all citizens. The second thing to say is the cost of this epidemic economically is running into millions of dollars. And I think it does not make economic sense to move forward without as rapidly as possible making vaccination free of charge to all citizens.
Hmm.
And I'm advocating, as I think we all should, for our ministry and our government to find the money to get enough doses of vaccine available for the 10 million citizens. That's $100 million. And I'd be a little disappointed if Zimbabwe can't do that. Then finally, as to the choice of vaccine, there is a worldwide shortage of vaccine. So I really think we're going to have to take what is available and what we can get. In terms of the vaccines that are approved so far, they are all, as far as we know, and we only have short-term data, safe, and they are all effective. And there are two ways of measuring efficacy. One is whether it stops you getting COVID in the first place. And the second thing is whether it stops you getting severe disease. So a vaccine may not be completely effective in stopping you getting COVID, but as long as it prevents you getting severe disease, put in hospital or dying, that actually is a pretty good measure. Of the vaccines that we might easily get in Zimbabwe, as far as we know, they all do that. So personally, I wouldn't mind if I had the Sinopharm vaccine, the J&J vaccine, the Oxford AstraZeneca vaccine, or indeed the Pfizer vaccine.
Mark, thank you very much for that, because we have Mavis Falala online who is asking, all these vaccines were developed before the new variant. Are they going to cover us for the new variant? And the one that we are here is about to evolve.
So the answer to that is we don't know yet. The study in South Africa that raised concern about the Oxford AstraZeneca vaccine was because it appears to have lower protection against acquiring COVID. But we do not have data as to whether or not it prevents severe disease or death, which it may still do. So South Africa have taken a decision on a limited amount of data to not go with that vaccine and to go for other vaccines. And it may well be the right decision. That decision was taken by their committee on limited evidence with good faith and with all the other options they had.
Yep.
If somebody came to me and offered me, said, look, the only vaccine we've got is the Oxford AstraZeneca, I would happily take it.
Yep. So another one directed to clinicians is, please check off my feeling that the vaccine has caused deaths in some countries.
No, we have no evidence for that.
Thank you.
Like any vaccines, there is a very small 1 in 100,000 risk of having an anaphylactic reaction, an allergic reaction to the vaccine. But that would apply to measles, polio, and all these other things as well.
Yep.
You've got to remember that a lot of countries have elderly populations in nursing homes that have a lot of comorbidities, and they have a death rate of so many per month, whatever happens. If you go into a place like that and you give everybody COVID-19 vaccine, 2 or 3 people may die in the next month. They were going to die anyway. And it's quite possible that everyone says, oh, they only died because the vaccine came in. As far as we know, that's all that's been happening so far. There's no evidence that the vaccines are killing people.
Thank you so much, Mark. Thank you for your time, and thank you for being on the previous episode where we were dealing with the clinicians talking to us about what is vaccination all about and what's the science. We are going to have another series on facts and myths, and please stand by. We will call on you. I want to go back now to our insurance, medical insurance team. Doug and Vudi, what is the priority listing? We've heard about the challenge of procurement, the quantities are limited, the monies are limited. Do you have a lineup or who's going to be in the front of the queue? And what is the lineup that you have worked on as the limited supplies hit us?
Maybe if I can come in there, Lindiwe.
Thank you, Vudi.
Basically, we work under guidance of the Ministry of Health and Public Health experts, and there are national priority lists that start with, to my knowledge, the frontline workers, and they move on to look at the elderly and so on and so forth. Generally, we want to make sure that we comply with that as much as possible. But ours being a private sector initiative, it means there's people who have specifically bought, particularly for their employees, who they want those employees prioritized. So I hope that clears it.
Okay, thank you. On your side, Doug, what's the situation?
Very similar to Vuli. I think, we want the productive people to go back safely to work. And I think so do industry and so do the firms want to protect their employees. So that to me is definitely the priority. But again, the priority is for us to get herd immunity, to get to the 10 million vaccinated in the country. But I think the mainstream frontline workers are the ones. So if we get enough money in and we get the vaccines in, those are the ones who will be queuing up to get their free vaccines.
Please, may I ask a pedestrian, selfish question? I wake up tomorrow and I have to travel to the UK. I feel very vulnerable. Can I walk up to Masca, CIMAS and say, please, can I be vaccinated? I'm below 60. Does that make me priority, or I have to jump through some loops and hoops before I qualify?
I would hope that once we have, through the Ministry of Health, enough vaccines available, that would become a priority, because part of that effort to go to the UK may likely be connected to your work as well. So, yeah, I mean, I would like to see that happening. I don't know if we can guarantee that until we know how the supplies, as Mark was saying, there are a shortage of vaccines available, and especially if the ones that are registered in Zimbabwe are not available and we have to wait, we may all have to wait.
Yep. Why I was asking that is because we just want transparency in the system. There's got to be sufficient checks, but I think it's important to know where to knock on which doors. Otherwise, we stimulate a gray market, which we hear in some countries is already happening. I don't call it black, it's gray. Coming back to my key question, when is D-Day? When do the doors open? Government doors are already open. Dr. Wedun Debele just declared that he's been a lucky one. When are the doors for private sector supply rollout going to open? Do you have a date?
Vuli, you've been chatting to the Ministry of Health. Do you want to come in?
If maybe I can come in there. I think the issue is that we're at a stage where we would like to make sure that we've raised sufficient money. There's then issues of procurement that have started. I think we just need to be patient because there's a lot of logistics involved in getting that vaccine. So it's not something that I can say categorically to you that would like this to happen next week or by end of March, for example. Because we haven't even placed those orders. It takes time to actually place the orders and get the vaccines in. We're hopeful that in the next week or two, we'll conclude our internal organization issues, which gives us much to sort of confirm the supplies. And for me, my wish is that by May, June, we should be moving with this. But
I'm glad. I was going to push you, Vuli, to your wish list, and we want an indicative date. And May, June, as you say, we don't want to be planning forever until this thing overtakes us. So I think if we have an indication of where we are going, it gives us all sufficient comfort that things are in the pipeline. Like I say, let's avoid a parallel market or an obscure market that starts providing these things on the side, and we don't know how sure, how safe. So if we've got an indicative timeline, it helps. Gentlemen, it's been a pleasure speaking with both of you. I've not covered everything, but I want to give you each just 1 minute. If I didn't ask any questions, if I just muted myself and said, Doug Bramson, Masca, what do you want to say to the world about vaccine rollout, where we are, what you want to see, and what should happen when. What would you say? I'm coming to you, Vuli.
Yeah, so in a minute, it's kind of hard, but a wish list would be to see that all Zimbabweans have access, in line with what Dr. Dixon was saying. If we in the private sector can assist quite transparently, that would be great. So, for example, a wish list immediately in my head is, let's not prioritize only the public sector health workers, but what about all the private health sector workers? All the pharmacists, all the frontline nurses, all the doctors who are working tirelessly. And I'm really pleased to hear that Dr. Wedu has had his vaccination, but I hope to hear that all the doctors and all the nurses and all the pharmacists and all those who are working on the front line get protection as soon as possible. And at the same time, we can be starting to build up a good reserve and be negotiating or working very closely with the Ministry of Health to get the private sector rolling. And the more we can get, so if we can get 1.5 million doses or 3 million doses, we can donate 1.5 million to the public sector as well. I would like to see us reach our 10 million before September. That's what I'd like to see.
Excellent. Thank you so much for that aspiration. And we will work with you and bring you back on stage on I Am for Bulawayo. And thank you for your service, Doug, as a trustee of I Am for Bulawayo fighting COVID-19. We've benefited from your publicity materials that you've developed from your time in the finance and procurement team and supporting our office, which is just down the road from you. Thank you so much. That's the spirit of volunteerism that has brought us this far. We appreciate it.
Thank you, Professor Majele.
Over to you, Vuli. You have your 1 minute. No questions asked. What do you want to tell the world?
Thank you, Lindiwe. The thing is, just to reiterate that as the private sector, we are working to complement the public health sector in making the vaccine available to as much the country as possible so that we attain that herd immunity. So for me, it's actually enabling. We want to enable ourselves as the private sector, but also enable the public sector to be able to do this. Do it also, yes, in a transparent manner, and we do not wish to see anyone paying for a vaccine. We do not want to see a black market for a vaccine, or you call it a gray market, I call it a black market. We don't want to see that, because the vaccine must be free to all the people that need it in the country, and it is our wish. But also just to say that while we expect the vaccine to help us COVID-19 and reduce the severity of the disease, for me, I continue to urge all of us to continue to maintain vigilance and to practice the recommended preventative measures, and to continue to be hopeful as we continue to be hopeful for a cure in the future. But also, this is a wake-up call to think about our health system. And as individuals, I think as governments as well, to start investing more in our health system. We cannot be reacting to crises in this manner all the time. I think we really need, even as individuals, to start investing in our health. Thank you.
I love that. We couldn't have ended on a better note with you, that it starts with you and me. I think for a long time, we have become so dependent that anything that is needed is either from a donor, and that donor is international, or from a government. It's wake up Bulawayo, wake up Zimbabwe, wake up to everybody, all hands on deck. We cannot be reactive. Let's be proactive and get all our health facilities ready, not just for COVID, but for future pandemics and our daily health needs. Colleagues, I've got with me Mr. Busisa Moyo, who's going to wrap this all up. We're privileged to have him as our chairman of I Am for Bulawayo Fighting COVID-19 Trust, but also more important at national level, he is Mr. Zida. He's the chairman of Zida, he's the chairman of Trade Fair. So we couldn't have had a better person to close this. Thank you for your contributions on the chat. Over to you, Mr. Moyo.
Well, thank you very much, Professor Majele, for a wonderful conversation that we've had today. I want to thank our guest, Mr. Vulindlela Ndlovu. I want to thank Mr. Doug Bramson, who have been, the two of them have been our panelists today, our key discussants, the advising doctors, Dr. Chirisa, Dr. Dixon. Thank you very much. And thank you again to you, Professor Majele, for moderating this session. Well done, a job well done. We are privileged to have you in I Am for Bulawayo, heading our PR and communications section, and being a pillar in the city, not just in the city and in the country. So thank you very much for that. I want to thank our secretariat, young lady there, Batabile, you've heard her name being mentioned there, working tirelessly in the background to put this all together. I want to thank Mr. Tando Nkomo, who is part of our communications and PR team, site, who are communication and PR partners in this session. They've been beaming, they've been with us from the beginning as I Am for Bulawayo, very much a part of what we do in getting communities like Bulawayo to be connected to what's happening at the national level in terms of information, in terms of preparedness of institutions in the city. And we've been working with them. To the trustees of I Am for Bulawayo, some of who are on the call, I'm not going to mention them by name, but I want to recognize them and say thank you very much for attending. I want to thank my chairperson in Business Fighting COVID, Dr. Charity Jinya, who's recently been appointed to the Monetary Policy Committee. I want to recognize her presence today. Actually, this idea came when we had a similar session in Business Fighting COVID, but we felt that we needed to connect it to smaller groupings like I'm for Bulawayo and get the word out on vaccination. I think over 200 million people have been vaccinated worldwide in over 90 countries. So Dr. Wedu is part of that statistic today, and many others who have taken the vaccines. So yeah, this is what we do to get the word out on information concerning COVID so that we don't get sick and so that we don't perish in light of this pandemic. Thank you very much, colleagues, and have a good Monday evening, and God bless you all.
Thank you, and goodbye, and stay safe.